Hello, I'm Michele Meehan and welcome to my website Parenting Matters. As you may have read in the blurb on the website, I'm a registered nurse and I've worked for a long time, probably 50 years in paediatrics or children's nursing, and more recently for the last 30 years working at the Children's Hospital as a clinical nurse consultant. And in that work I started working more serendipitously, but around with children and babies with feeding problems. And so most of my work now is solely about infant and toddler feeding. I left the Children's Hospital about almost 5 years ago now and have established a private practice called Parenting Matters. And 90% of my work is around babies or toddlers who are struggling with feeding. I'm particularly interested in the sort of three types of babies I see, I guess. There's the younger babies who are just starting to really struggle with the bottle feeding. They might be doing quite well the first couple of months, but then mums are complaining that they're drinking just a bit less and just a bit less, so that by the time I get to see them, they're often drinking 50 mils at a feed instead of 90. And they're usually looking good still because they got all that baby fat still. And so when they've been complaining about what's been happening, you've been reassured, well, he looks great, just keep doing what you're doing. And what you're doing is worrying all day long about the feeding. The other area I'm interested in is the introduction of solids, and most babies have no trouble starting. But there's always the few that, they just really don't like anything different than the breast particularly, or the milk. And then there's the lot that by about 10 months, they're really not making much progress. And then we've got the toddler, of course, who's got a mind of his own and doesn't want this and that. And some of that's just normal toddler behaviour. But then there's the toddlers whose range of food is just getting smaller and smaller. So all you can get into them is rice, crackers, yogurt and cheese and pasta. And then there's a range of children who are a little bit older who are just still not very adventurous about moving on. And so they're the sort of areas that I'm interested in. And on the website you'll find I've got some booklets. This one is just around issues related to feeding, bottle feeding, and in the middle of the book I've got a sort of an approach and a plan about how to approach this sort of bottle refusal. The second little booklet is called The Transition to Solids, and this is dealing with just when you should start, how you should start, and just a little bit about some of the problems you might come up with. They just throw the food away, they gag on lumps, they're still on puree at 12 months. And the other area I'm interested in is the clingy infant and toddler. And what this relates to feeding is that often these are the babies who just will not wean off the breast. And because weaning is about separation. And so babies who are reliant on the breast still at 12 months and not taking solids will usually be starting to lose weight. So that's just a brief summary of the sort of work I do. And I'll do some other videos later addressing some of the individual problems. But if you feel that this is some area that I might be able to help you with, then feel free to use the website to book an appointment. And I look forward to seeing you and giving you some help where needed. Thank you.